All right. Well, good morning or good afternoon, depending upon which side of the country that you're on today. Just want to say a welcome to you. Welcome to the 2024 Family Treatment Court Practice Academy. And today is actually this is our second Practice Academy for the year. And the theme of this series is Pathways to Prevention. And as a part of that theme, what we're going to do is explore different definitions and methods of prevention. And specifically, our content today is going to be around identifying and supporting parents with co-occurring disorders, or you may hear me refer to it as COD. So while we have hundreds of people all across the nation joining us today. And so I want to take some time while people are trickling in. We're going to have two polls that are going to come up. And we're using Mentimeter today for those poll questions. So you can go to menti.com, that's MENI.com, and you're going to type in the code that you see there. And the code again, 9732505. And then once you're in, make sure you keep the window open so that it's easy to access later, because we're going to have additional polling questions throughout our time together today. And just as a reminder, the Mentimeter responses are anonymous. So we encourage you to be raw, be real. And so the two questions that we have for you, the first one is, where do you work? So you're going to have an opportunity right now to pin where you're working right now. Where are you within the US? And hey, man, if you're outside of the US, man, if you're connecting, with us from another country, please put that in the chat. We would love to know that you're here as well. So as you can see, man, we have people popping up from all across the nation. So super excited to have people, whether it's Florida, Arizona, Oklahoma, Nebraska. Man, we have the East Coast covered, the Midwest, the West Coast. I'm just excited to see people from across this entire nation that are coming together today to learn and be a part of this Practice Academy. And so as you see those coming in, the second question that we have for you, and again, we're talking about co-occurring disorders today, is what is your level of confidence when working with parents with co-occurring disorders? And you have the ability to rate it there, 1 being not at all, and 5 being very confident. Maybe this is the first time that you've heard of co-occurring disorders, or maybe you're, a seasoned vet who have been serving families and helping to improve outcomes for families with co-occurring disorders. So go ahead right now and kind of put what your confidence level is. And the thing I love about Menti, man, it's real time. So we're seeing right now the majority of the participants are about a 3.3. So it's like, hey, I have some working knowledge. This isn't the first time I've heard of co-occurring disorders. Maybe I'm in the field. I'm a practitioner that's serving families. So again, I think it's good for you to see and just get a sense of who all is at the table today and who all is participating in this Practice Academy. So thank you so much for filling out those and being a part of those two polls. Now, real quick, before I talk a little bit about CFF and before I dive into the agenda, I want to remind you, if you haven't had a chance, there was a 9-minute video that was about 5 facts of co-occurring disorders for professionals. If you haven't checked that out, I encourage you to do so. And you'll actually, there will be a link for it that you'll see. It's actually also posted on the Practice Academy website as well. Now, if you do get that link, or if maybe you're on the Practice Academy website right now, don't watch it right now. We want you present, in the Practice Academy today. But that video is going to be super useful to you. It really helps to ground the work that you as practitioners are doing when it comes to serving families with co-occurring disorders. So next, I want to talk a little bit about CFF, about the Family Treatment Court, technical assistance, and a couple of other housekeeping pieces before we dive into the agenda. First, I want to talk a little bit about myself. I'm Sean Couch, and I'm a senior program associate with the Center for Children and Family Futures. And a little bit about myself. I mean, before I talk about like the professional piece, I like to tell everybody that I meet, I am a Texan through and through. And which means during today's session, I may use the word y'all. Like it's just, it'll naturally come out. And because I'm a Texan, that means my favorite meat is brisket. My favorite fruit is brisket, and my favorite vegetable is brisket. So I am a Texan, born and raised, had an opportunity to serve our country in the United States Marine Corps. And then after that, I began my work in this service delivery system, specifically in the mental health and substance use field. Everything from working at a group home to working at both the county and the state level in various initiatives within Oklahoma around serving families impacted by substance use. And then I also uh, had a lot of experience when it comes to specifically plans of safe care and ways to wrap families around with as many supports and services as possible to help them continue their recovery journey. And then during my time here with the Center for Children and Family Futures, man, I get the privilege of providing technical assistance to states, tribes, local jurisdictions to help them live out their vision and live out their goal of improving outcomes for families. And in fact, I love it because it's so in line with my why. You know, I don't know if you've ever had an opportunity. Simon Sinek has this book called Start With Why. And when I went through that, it really helped me figure out kind of what is my why. And it aligns so perfectly with the work that the Center for Children and Family Futures is doing, which again, my why, I'm all about how do we restore hope and empower families that are affected by substance use. And in my capacity now, what I like is I get to do by equipping the workforce and equipping the workforce in such a way that they go to work inspired, that they feel valued while they're there. And then, man, they return home fulfilled each and every day. So that's a little bit about me. Now, about the Center for Children and Family Futures. Man, CCFF, we strive to prevent child abuse and neglect while also improving safety, permanency, well-being, and recovery outcomes with equity for all children, parents, and families that are affected by trauma, substance use, and mental health disorders. So as you can see, that right there, that is our North Star. And that's what everything that we do as an organization aligns with. And one of the things as an organization that we are also excited and honored to be able to do is to partner with OJJDP as well. And in fact, one of the ways that we fulfill our mission is through the Family Treatment Court Training and Technical Assistance Program. And man, that's a mouthful. So you may hear me refer to it as the FTC TTA program. But it's been funded by OJJDP since 2009. And that through this program, we provide training and technical assistance to OJJDP FTC grantees, as well as states, counties, and other jurisdictions that are looking to either implement or enhance their family treatment court. And on the next slide, what you'll see are OJJDP's priorities. You know, and I love when you think about the mission of CFF, man, it aligns perfectly with the vision and the values of OJJDP. So the priorities that they have is, of course, to treat children as children, to open up those opportunities for system-involved youth, and to serve children at home with their families and in their community. So we're so excited to play, even if it's a small part, in helping OJJDP accomplish their priorities. So again, I talked a little bit earlier, the topic that we chose for this Practice Academy is Pathways to Prevention. And this is the second of 3 total standalone courses throughout 2024 that's provided to you and your teams to really help resource you to implement various prevention efforts. And all the recordings from the Practice Academy, all the materials are going to be available on the Practice Academy website. So if you haven't bookmarked that already, man, I encourage you to do so. This specific course, again, it's all about identifying and supporting parents with co-occurring disorders. So I'm super excited to be able to dive into that content. And we really want to make sure that you as professionals understand that parents with substance use disorders are also likely to have co-occurring mental health disorders. But the thing is, we find that many do not have support parents with co-occurring disorders. So that's the whole purpose, again, of this Practice Academy, to be able to equip you for that work. Now, a little bit more information before I talk about how the lay of the land for today. You know, it's estimated that approximately 40% of adults with a substance use disorder have a mental health disorder. So again, as you can see, and there's so many stats that I could quote around that, but there is such a critical need to figure out how do we appropriately deliver services for those affected by co-occurring disorders. So I want another poll question to come up right now. And as that poll question is coming up, it's do you currently screen for co-occurring mental health disorders? So go ahead right now. Again, hopefully you still have Menti up. And want you to go ahead and see when does your team screen for mental health disorders? And you have some, again, some don't, some it's at that entry point. That's where we see a lot of people leaning to right now. It's good. A lot at entry. There's some that don't screen. So as you can see, that it looks like a lot of those that are on the call today, you know, about half screen at the entry point. So we're going to talk again. We're going to dive into some of those details around that screening piece as well. Not just screening, but assessment and treatment and support. Just as a reminder, again, there's so many resources that are available for you on the Practice Academy web page. Please make sure that you visit that. There's videos, a companion guide. There's a digital dialogue where we had an opportunity to interview the panelists that you're going to interact with today. So you're going to get to hear their heart and kind of what moves them as well. And so again, today our agenda is we're going to have a facilitated discussion with the panelists, and then you're going to get an opportunity to go into breakout rooms and really dive into some of the nuance with those panelists. So excited for that opportunity today. Make sure you use the chat box. Man, I see so many people right now using it. That's phenomenal. Man, use it to dialogue, you know, with your fellow practitioners, with the CCFF staff. It's a place to ask questions. And then again, you're going to have those small group discussions within your breakouts. So now what I want to do is I want to transition over to and have a facilitated discussion with the phenomenal panelists that we've brought here today. And so we have 5 panelists with us. And so I want to start out, man, we're just going to do some introductions. So whenever I call you, man, panelists, if you'll just give a quick intro, you know, kind of your name, your role, your agency, and kind of what your work is when it comes to working with families affected by substance use disorder, or if you're a part of a family treatment court, let us know that you're a part of that and kind of what size. So again, we'll do that intro, and then I would like for you to kind of, you know, unpack in 2 or 3 sentences your why. Like, what is your elevator pitch when it comes to supporting parents with co-occurring disorders? So with that, let's start with our first panelist, who is Dr. John Groppengieser. And so, Dr. Groppengieser, I'll turn it over to you for your introduction.
Yeah, thank you, Sean. So hello, everyone. I am Dr. John Groppengieser. I am located in southeastern Wisconsin. My office is in Milwaukee, specifically, but I work for an agency called Professional Services Group, and we provide services within 15 different counties in Milwaukee. And really, our main population is the underserved population, and many of which are struggling with substance use disorders and co-occurring mental health disorders. For me, I've actually had the pleasure of working directly in a family treatment court in Milwaukee County. And so I served as a behavioral health consultant with Milwaukee County for approximately 5 years. So that was integrating me directly into that program, going to staffings, meeting with participants. My elevator, I guess, would be just looking at the fact that, you know, every participant and every person with co-occurring disorders is so unique in their recovery, and everyone's different in how they receive treatment and how they respond to treatment. And it's so important to understand the individual as a full person. So understanding all those factors that are going into the substance use disorder and the mental health or co-occurring disorder, so that we can obviously work towards the greatest outcomes for those individuals and tailor everything to their needs.
Awesome. Thank you so much for unpacking that. Our next panelist, for your introduction, let's do Miss Stormy Howe.
Hello, thank you, Sean. My name is Stormy Howell, and I am the Treatment Program Manager for Clallam Counseling Services with the Lower Elwha Clallam Tribe. So I'm located in Washington. I saw we had quite a few Washington people joining us here today, so I was excited to see that. And we are up on the Olympic Peninsula, so we're way far away from pretty much everyone and everything. So we're a very rural community, but I've been the treatment program manager here for about 6.5 years. And prior to that, I was actually a drug court coordinator for our county drug court. And I'm currently on the team for the Lower Elwha Clallam Healing to Wellness Court as well too. So I have a very strong and soft spot in my heart for healing to wellness courts. So as far as kind of my elevator pitch, my why is that when someone is in active addiction or is living with untreated mental health, it really impacts their whole person, meaning their mind, their body, their spirit, their social and emotional connections as well too. So healing needs to happen to all of those pieces. And when you get the privilege and the opportunity to work with parents, you not only get to work with them and help them change their lives to the future that they want to have and the life that they want to lead, but you also get to impact their children as well too. And that to me is just really huge. And I'm really grateful to be in the line of work that I'm in. So thank you.
Oh, thank you, Storm, man. Your passion comes through in everything that you say, so appreciate that. Next, let's go with Miss Rachel King.
Hey everyone, I'm Rachel. I work at Vanderbilt Medical Center. I'm the lead recovery coach there. I'm a certified peer recovery specialist as well. We work with women who are pregnant or postpartum period, and we are an interdisciplinary team. So they come, they get their OBGYN care there. They get social work services for housing support and SDOH barriers. They get to work with a peer recovery coach. We have 4 of those on our staff, and it's an outpatient MAT clinic. So we're really just trying to get the best outcomes for moms and babies. And my why, I am a person with lived experience. I have 3.5 years in recovery, and I love this working with pregnant women because whenever I was accessing care while I was still in active addiction, I felt very stigmatized and just judged by that in medical settings. So I think it's really important that we're just meeting everyone with empathy and like Stormy said, treating the whole person, accepting them exactly as they are when they come into our care. And that's my why.
Awesome. Thank you, Rachel. And I tell you, attendees, if you've never heard of Firefly, man, they are doing some phenomenal work there in Tennessee. So, Rachel, I'm excited to have you. Love having your voice as a part of this panel today.
Thank you.
Next, let's go with Dr. Michelle Leff.
Good Thursday to everyone. My name is Michelle Leff, and I am currently serving as a senior medical advisor at the Center for Mental Health Services, CMHS, within the Substance Abuse Mental Health Services Administration, SAMHSA. We provide services grants to governmental entities, states, territories, counties, as well as community nonprofit service providing organizations. As a general and child and adolescent psychiatrist, I'm working in various CMHS programs, including co-occurring disorders in adolescents and adults, general child and family services in our various grant programs, and I co-lead a SAMHSA work group examining emerging therapeutics such as psychedelics. So here's my elevator pitch for this audience. Unless we take a comprehensive approach to health, we won't be effective, no matter how much time, energy, or money we expend. And I think the approach we need to take goes even beyond parental co-occurring disorders, but that's a start. Screening, evaluating, diagnosing, and treating these co-occurring disorders is important. I think we need to keep 2 barriers in mind, and I think Rachel mentioned one of them, and that is one of them is stigma. There's still stigma surrounding mental and substance use disorders, and I think that everyone who is here today really should try to educate people in your professional domain, your coworkers, about co-occurring disorders. And then the other thing I think we need to think about is parents' vulnerability. The challenge that we have is to work with parents, your clients, and patients to feel safe. If people feel vulnerable and unsafe, then you're not going to learn anything about them. They'll deny symptoms and substance use. So that's the challenge that I think we face. And I think it's especially difficult in judicial systems. Thank you.
No, thank you. And again, thank you for carving time out of your busy schedule to be a part of this conversation. And man, participants, I hope you just see like Dr. Leff being here just speaks to SAMHSA's belief and value in the work of serving families affected by co-occurring disorders. So thank you again. We appreciate you, Dr. Leff. And then last but not least, and Dr. Joanne Nicholson.
Thanks, Sean. I'm Joanne Nicholson, and I am a professor at the Institute for Behavioral Health at Brandeis at the Heller School at Brandeis University outside of Boston, Massachusetts. And I am a clinical and research psychologist by background and training, and have spent many years partnering with parents in providing services and developing and evaluating services and in research, both in the United States and actually internationally. So I've had the benefit of seeing programs in other countries as well. My why, and this is a really important piece to me, I spent the first 10 years of my career as a forensic psychologist doing evaluations for the courts and the child welfare system. And my team and I did, I'm embarrassed to say, hundreds of these evaluations. And it became clear to me that there probably was a better way to help families to do the work, to use the money that agencies were spending, and to support families in treatment and recovery. So my elevator pitch is: one, treatment and recovery happen in the context of families and communities. Two, that knowing about a person's parenting and family roles and goals and responsibilities enhances our capacity to provide effective supports and services. That engaging people as parents opens us up to avenues for positive impact. And I would really like to emphasize the importance of considering families as partners in the work that we do.
That's good. I appreciate that, Dr. Nicholson. And I think you just put a great period on these introductions. So I hope as attendees, you see just the breadth of experience and expertise that's a part of this panel today. So with that being said, man, I want to go into a time of discussion with these panelists. So Dr. Leff, I'd like to start with you. What are the pathways to comorbidity for co-occurring substance use and mental health disorders? And then can you share some statistics around the prevalence rate of co-occurring disorders?
Sure. I think I'm going to start with the statistics first. So this is hot off the press. Just last week, SAMHSA released the 2023 NISDA findings. NISDA is the National Survey on Drug Use and Health, which is an annual survey supported by us. And last year, about 68,000 people all over the US were surveyed. And I'm going to give you a little bit about adolescence, because oftentimes substance use starts or is first diagnosed in adolescence. So in this sample, 24%, so that's a quarter of them, had either a substance use disorder or a major depressive episode. And when you looked at the two groups, most with major depressive episodes did not have a substance use disorder. However, they were more likely to use illicit substances in the past year, but not necessarily have the diagnosis. But you do wonder about that trajectory. However, those adolescents with a substance use disorder, almost 50%, so almost half of them had a major depressive disorder. And then for adults, and I'm going to be broad, if you look at the survey, they do break it out into different age groups. But about 33%, so a third, had either any mental illness, not necessarily a serious mental illness, or a substance use disorder. 1/3 of adults who had any mental illness had a substance use disorder. And those with any mental illness and substance use disorder comprise about 50% of those with SUDs. So again, kind of like the adolescents, but it's a different diagnosis. And the highest co-occurrence was in that young adult range, and that in this survey is 18 to 25 years old, and it decreases with age. So now I'm going to attempt to answer your second question, Sean, and this is a much less exact answer. So when we think about pathways, we want to try to come up with causes, contributing factors, correlative factors, and correlative factors are ones that have not proven to be causal yet. And sometimes we can tease out and identify factors, but there is still unclear common pathways. And if you've worked with families, you've seen this and maybe in your own family. Two people with the same biological parents, close in age, grew up in the same house, attended the same schools. One may develop a psychiatric condition and the other may not. So there are multiple factors that in some unknown and unpredictable fashion can lead to co-occurring substance use and mental disorders. And here are some of the ones that we know. So genetic predisposition, both for substance use disorders and mental disorders. Trauma is huge, and that's adverse life experiences. There are many types of trauma, and there's a spectrum of severity, and there are also conditions that may protect a child or place a child at greater risk. For example, if a child has no safe or responsible caregiver, one needs to think about the child's own coping skills, etc. And then we also have to think about social determinants of health. And when I talk about social determinants of health, I'm thinking about economic stability, education access and quality, healthcare access and quality, neighborhood and built environment, and social and community contexts. And then the other two broad buckets are a person's intellect, emotional makeup, or temperament, and those can be protective or risk factors. And then there are some environmental factors, external factors, for example, availability of substances, peer groups, etc. So all of these, I'm sorry, I can't answer the question more directly, but all of these make up and contribute to developing a substance use disorder and or a mental disorder. Thanks.
No, thank you. And again, I appreciate you unpacking that for everybody. And I'll just to let participants know these questions that we're going through right now, these are questions whenever you register. So we're excited to be able to, again, take the questions that you submitted and be able to ask those to our panelists. Next, let's go to Ms. Howe. I want to talk a little bit about one of the questions was around screening and assessment. So how and when should mental health screening and assessment take place in a child welfare case? And then what are some strategies that teams can use to provide that effective integrated screening in their practice?
Oh, yes. Thank you, Sean. The short answer would be as soon as possible. But to kind of build a little bit more on that, substance use disorder and mental health diagnoses can be really, really intertwined in a person. And so doing that dual screening at the beginning is really important because you want to be able to provide services and treat both the SUD and the mental health component, excuse me, as well too. It can be really challenging to unwind those two. So one of the things that I think is really important is to reassess an individual regularly, especially if they have been actively using. I think the guidelines provide that you want to do a reevaluation at about 4 weeks of abstinence from illicit substances for an individual to help distinguish between what is part of the mental health and what is part of the SUD or the withdrawal from the SUD services. I also really think that reassessing at a regular interval is important, because when someone first comes in to see you, they tend to be very distrustful. And most of them have a whole lot of very valid reasons as to why they are. And they are in a really chaotic and traumatic part of their life. We were talking about people and things involving their children. And that is a really hot topic with a lot of people. And for a lot of our clients that we see come in, it's hard for them to become vulnerable with a stranger that they've just met. So as the person's progressing through services, I mean, really keeping in mind that you're trying to gain their trust. You want them to know that it's okay to be vulnerable and express those feelings. And I think with a lot of people too, Dr. Leff mentioned trauma, and that's a huge component as well, because a lot of people have trauma that leads them into their use, and a lot of people experience trauma during their active use as well too. So there's a lot of kind of moving targets there that you want to unwind. And so I think it's really important to look at those as the person progresses through treatment and what other services may be needed or what other issues may arise. As far as how to do that, my short answer is collaboration. But I think it's really, really important for the person who is providing the mental health services and the person who's providing the SUD services to meet regularly, to share information, to share treatment plans that they're working on, to share big achievements or big, areas that need improvement for someone as well too. So they're both really on the same page. Where I work, we're very, very lucky to have a mental health provider that's part of our mental health program, but she's stationed at our SUD facility. And so that makes collaboration a whole lot easier. You can just walk across the hall and talk to somebody. We also have a regular staffing day where she comes in and staffs we staff all of our mutual clients as well too, so that we can try and keep that communication going, because really that's the best thing for the client, and being sure that they're receiving the best services for them and their individual needs. So thank you.
No, thank you. And I love that you spoke about collaboration. That's something, like thinking about it even through a family treatment court lens. When we look at successful family treatment courts that are, rocking it out and really improving outcomes for families, they have strong, meaningful, intentional collaboration across child welfare, the courts, substance use treatment, and so on. So I love that you mentioned that, because, one of the things that we like to say is, when it comes to serving families that are affected by co-occurring disorders, it's not a child welfare issue. It's not a substance use treatment issue. It's not a court issue. It's a jurisdictional issue. It's a state issue, where kind of like everyone has to come together to figure out, how do we improve outcomes for these families? So I love that you mentioned collaboration there. Now, kind of a follow-up question to that is for Ms. King, man, how can clinicians help parents understand their diagnosis and treatment needs?
Yeah, Sean. So when I'm working with families or moms, I'm really, if they have questions about their diagnosis, a lot of times as a peer recovery specialist, I'm referring them back to their medical providers to explain that to them. But I think one of the biggest things that I've heard my team mention when they're talking about this is just breaking down each diagnosis, making sure that they have a clear idea of what the symptoms are, how it presents, maybe why they're entering into treatment, like with let's say BPD or the personality disorders, and their symptoms are presenting one way, and then clinicians or the medical team may have judged them on that, instead of actually knowing, okay, this is just the symptom presentation of their diagnosis. And I think if they understood that, they could have a better idea of what it is. Giving them something tangible. I love pamphlets, handing them something that says, this is what this diagnosis is. And then from my end, just sharing lived experience of, relating with them. I was really confused when I got this diagnosis. I didn't know what it meant. And I think just to have somebody there to say, hey, I've been through this too is really helpful as well.
Mm-hmm. That's good. And yeah, I just think that speaks to the value of those with lived expertise. Again, being able to go stand alongside them shoulder to shoulder and help them walk through that recovery journey. That's so key. So I appreciate you unpacking that for us. I want to go back to, there was a question that was submitted during registration around prevalence. And so, Dr. Nicholson, could you talk about just what do we know about the prevalence of co-occurring disorders in parents?
I think that Dr. Leff has done an admirable job of answering that question, particularly with the new NISDA data. So congratulations on the new data. That's fantastic. I think one of the challenges in putting data together, apart from the NISDA, is that so much of what we know depends upon what door people walk through. So people walk through the mental health door, they walk through the substance use door, they walk through the child welfare door. They might even walk through the door of their children's classroom. And so in some sense, our data or understanding of prevalence, particularly in our own communities or our own regions, is affected by how people come to us. So I wanted to pay attention to that. I also wanted to bring attention to some of the work that's being done on more marginalized populations. And in my case, it's parents with disabilities. And the fact that, as Stormy pointed out, trauma, and Dr. Leff too, trauma is a significant factor in people's lives. And there are many things that can be traumatic or convey trauma and disability. For example, military service, or a car accident, or being born with a disability. And something that we have learned a lot about is that many services are just not accessible for people with disabilities. So those AA meetings in the basement at the church, the veteran in a wheelchair cannot get into the basement at the church. And so I also like to remind people to think about those populations that we don't know quite as much about, but who may be in dire need of services and supports for themselves and their families. I'd just like to bring attention to issues of accessibility and acceptability for particularly people who have lived with trauma and who may be disabled by that or other conditions. So that's my pitch on prevalence.
No, thank you. Again, thank you so much for that. And I love highlighting, again, marginalized populations, those with disabilities and so on. So appreciate you answering that for us. We got about 5 minutes remaining during this panel discussion here. So Dr. Groppengieser, I want to throw it to you for just, how can teams bring focus to co-occurring disorders and mental wellness in staffing or in court review discussions?
That is an outstanding question. And I think there's a lot of directions you can go with that. And that's, I think, one of the key points that I want to convey here is that there's no right way to do this. There are so many possibilities in how you can bring mental health and awareness to co-occurring disorders to the courtroom and to the treatment court process. And I think some of the biggest things to think about are flexibility and creativity. Not all courts have the same access to funding or resources. So looking at creative and flexible ways to meet the needs of the court around mental health awareness and around co-occurring disorders and education and training that fits your court. And so that may be partnering with different entities within your city or your county. And then looking at, what do we really need? Do we want education and training for the team? I think that's a great place to start, is just do some general education and training around things we're talking about today. What's the prevalence of these disorders? Where are we seeing them most often? How are folks experiencing, or how are their experiences leading to some of these disorders? Providing some training and some education around that for the entire team, so folks that even those that don't have a mental health background can start to understand these a little bit better, is a great way to bring that to the forefront. The obvious one that we've already talked about, collaboration. making sure that we are using interdisciplinary teams and that we're collaborating with those treatment providers and other mental health professionals that may be part of the team to get their perspective. So that might include peer support, that might include skill development staff that are working with our participants. And so really focusing heavily on that collaboration, getting those folks at team meetings, ideally getting some of those treatment providers in the courtroom for that staffing process, having them available when the participants are meeting with the judge or available afterwards to talk about how things are going and check in on mental health. Obviously, there's some feasibility there. Cost, time becomes problematic. But when that's doable, that's going to be a best practice for sure. And I think, again, just making sure that we're getting regular contributions from the team. And if that can't be in person, that we're getting good written reports. And written reports are nice, but it's always nice to talk to someone and get all the context. So I would really stress that piece of when you're doing that collaboration, do more than just, hey, send an email with an update. Because often we get, they're attending, they're working towards their goals. It's great. We want to hear more. What are you seeing? Are there any signs of mental health concerns that we're not seeing that you are seeing in therapy? Is there anything maybe that we need to know about that's going on outside of this whole process that might be impacting their engagement? There's so many factors. So I think just looking again at being creative and flexible and how you do that is so important.
No, thank you for unpacking that. And I love that you mentioned, again, training as well as collaboration again, because one of the things that we found is whenever we want to bring a team's focus to co-occurring disorders and mental wellness, you're creating a culture change. And culture change requires training. It requires meaningful and intentional collaboration. So I love that you mentioned that. And man, there's so many other questions that were submitted during your registration. So what we're doing, attendees, is you're going to have opportunity. We're taking all those questions that you submitted during the registration, and we're going to be providing those whenever you go into breakout rooms here in a moment, so that those questions can be used during the breakout sessions as well, because we definitely want to make sure that your questions get answered. So again, thank you so much, panelists, for just taking a moment there to dive into some of those questions that were submitted as a part of registration. I mean, attendees, as you can see, we have multiple lanes of expertise that are able to speak into the various questions that you had. And so we're excited to have them, not just as breakout discussions that we're about to have. And in fact, that's what we're going to do right now. We want to make sure that you have an opportunity, not just, for myself to have a dialogue with the panelists around your questions, but for you to have some true Q&A time with the specific panelists that you would like to. So we're going to, here in a moment, we're going to go into breakout rooms. All right, get Department of Health to commit to an integrated approach. Okay, how can we partner with our health department to do, again, kind of like some of the panelists were saying, meaningful collaboration. All right. Considering mental health screening throughout a family treatment court participation rather than only at entry. I love that. Like, not just doing it at one single point in time. Monthly milestone celebrations. And whoever put that, I'd do a cartwheel for you, because that's huge. Like, we have to celebrate those milestones. I mean, we all like being celebrated. So how do we incorporate that into our work plans, into our rollout, for the families that we serve? That's good. Advocating for our parents to be prioritized for assessments because of ASFA timelines. Oh, I love that. One of the things when it comes to family treatment courts, there's competing timelines that tend to always exist. But how do we work within those timelines to still ensure that parents are getting the supports and services they need, and that reunification is happening if at all possible? Again, more screening here. I have some around psychoeducation, peer support. Yes, the value of peers is phenomenal. Assessing throughout the whole process, understanding the importance of early screening. How can we identify as early as possible, not for surveillance, but for connecting with supports and services? Now, again, you'll have the information that came from the Menti piece that you're putting in right now. You'll have that after the session. But what I would like to do is in say 30 seconds to a minute, man, I would just love for our panelists to chime in on what is one step that you hope the audience takes because of the conversations today. Again, what is one step you hope that they take because of this Practice Academy? And so I'll start with, let's go with Dr. Nicholson first.
Thanks, Sean. I would say, based on our conversation, question your assumptions. Question your assumptions about disorders and about people who are parents, because it's a really value-laden place to work. So that's my takeaway message.
There you go. Question the assumptions. I love it. All right, Ms. Howell, what about you?
I talked about this a little in the panel discussion and in the breakout room, but collaborate, collaborate, collaborate. This is something that no one person or agency can do alone. And part of that collaboration, it's hard work and it's going to require educating partners as well too, but the end result is worth all of it. So yeah, reaching out and working with as many different programs and partners as you can to help your clients achieve their goals.
That's good. Again, collaboration. All right, let's go with Dr. Leff.
So my takeaway is, understanding that all the work that you're doing, you're not only treating the parent, but you're effectively treating the entire family. And I'm echoing what was said earlier. I can't remember which one of my panelists said it, but and your work is wide reaching. It's really difficult work, but it's worth it. Before I came to CMHS, I was at CSAP, so Substance Abuse Prevention, and I'm a huge component of substance use prevention and mental health promotion. Prevention definitely works. And while you may not identify as a preventionist, but working with parents, you are doing prevention work. And in all this work that you're doing, you're working to reduce the prevalence of co-occurring disorders. And I thank everybody for their dedication and work in this field.
Awesome. Thank you, Dr. Leff. And then let's go to Ms. King.
I think the takeaways that I would want everyone to move forward with based on our breakout room would be to educate people on stigma, check your biases, celebrate the victories that we talked about sometimes seem small to others, but are huge milestones to us. And then making care personal. Trying to get peers into your program to be able to relate to others, and just making that extra relatability in your program.
Mm-hmm. That's good. Thank you for that. Yeah, go on that extra mile and expressing empathy and having true connection. I like it. And man, to bring us on down the home stretch, let's close it out with Dr. Groppengieser.
It's hard to go last here. So many great thoughts from the panelists. I would say collaborate was one of the things that came first to mind. And in addition to that, just making sure to bring mental health into the courtroom and reduce that stigma, talk about it, make it just part of what we do, that we assess that. And it's not about mental illness, it's about mental health and wellness. And just be creative in how we support the parents in addressing their mental wellness.
Mm-hmm. Awesome. Thank you so much. And again, just another huge thank you to our panelists for carving this time out of your schedule to into the workforce in this capacity today. Attendees, just as a reminder before we end here, please visit the Practice Academy website. There's so many resources, videos, companion guides, supplemental resources. Make sure you access those. And then also this recording is going to be posted later this week, as well as the chat box and resources. And then for additional technical assistance, we encourage you to visit the Family Treatment Court email address at ftc@cffutures.org. And then don't forget to register for the next Idea Exchange. Man, it's happening September 19th. The link is in the chat, and you're going to get to have an opportunity to connect with peers across the entire nation all around this topic of co-occurring disorders. And then don't forget to register for the next Practice Academy course, man. It's happening on November 12th. And that topic, just like we talked about co-occurring disorders today, that topic's going to be about aftercare and just how important and how integral that is to setting families up for success and giving them everything they need to be able to live out wellness and their recovery journey. And then don't forget to complete the evaluation survey. Man, we want your feedback. And just so you know, this isn't feedback that just like goes out into the ether. No, we take this, curate it, and figure out how do we design products and resources, technical assistance, and events that really speak to you, the workforce. So please take an opportunity to complete that survey. The link's posted in the chat. You can scan the QR code there as well. And then if you would like a certificate of attendance, please complete that evaluation survey. That's how you get that certificate of attendance. And after you submit the survey, you'll be directed to a link so you can download that certificate. And then don't forget, man, join the listservs. Be a part of the community that's figuring out how do we leverage all of our resources to improve outcomes for families and equip them with what they need to live out their recovery journey in the community of their choice. So the links are in the chat. You can scan the QR codes. And man, with 30 to 45 seconds that I have left, man, I would just remind you, you're doing phenomenal work. I mean, you're in the trenches figuring out how do we improve access to care. So thank you for doing that. Thank you for trying to figure out how to collaborate meaningfully to improve outcomes for families. And then I would just remind you, even as we sit here today, man, there are families that are waiting right now. There are families that are waiting for you to integrate screening at a high level of multiple points. There are families that are waiting for public health agencies, substance use treatment, courts to come together and figure out how can they collaborate, how can they share information, and how can they leverage every resource possible to help improve outcomes for those families. So thank you again, and we look forward to seeing you at the next Practice Academy course on November 12th. Take care, everyone.